Joining us today. We are here as part of the lung cancer awareness series that we've been doing. Today, we discuss navigating treatment options for lung cancer. It's to ensure that patients and their families are aware of what are the options available and how they can make better choices on that. I will introduce our panelists in just a moment, but we do have, and we're very thankful to Dr. Priya Tiwari and Dr. Deepak Gupta for joining us today. As you are aware, Patients Engage is an online platform for patients dealing with chronic diseases, and patients share their experiences, caregivers share their experiences, plus healthcare professionals and other experts share their expertise as well. And we believe that the more informed people are, the better choices they will make, and they will also realize that they're not alone by listening to other patients' choices. We've done a wide range of content over the last few years, and we always put the patients and survivors at the center of our content. We are always looking at what they are looking for, what the gaps they are seeing in information or in support. And you will find our previous conversations on our YouTube channel as well as our Facebook pages. So you can follow us there. As I said, this is part of a series we've been doing through November on lung cancer awareness. And we've covered a wide range of topics, about knowing signs, symptoms, risks, how to get an early diagnosis, living well with advanced lung cancer. And the real message really is that lung cancer is treatable. Do not ignore the signs, and please do get yourself tested adequately, and we'll find out what that is. At 7 o'clock, we have another session on lung cancer, which is on living well after lung cancer. So let me now introduce our panelists today. We have Dr. Priya Tiwari, who's a senior consultant, Department of Medical Oncology at Artemis Hospital in Gurgaon. We've got Dr. Deepak Gupta, senior consultant, medical oncology, Bhagwan Mahavir Cancer Hospital and Research Center in Jaipur. And I'm Aparna Mittal. I'm founder of Patients Engage. A disclaimer, Pfizer is supporting this initiative, and it's meant for information and awareness only. It is not a substitute for medical advice, so please do consult either your doctor or the doctors on this panel directly if you have any follow-up questions specific to your situation. The views expressed are independent views of the speaker, and Pfizer or the platform may not necessarily endorse all of it. And for those of you who are watching, you can post your questions on Zoom if you are here, or on Facebook or YouTube, and we'll pick them up either now or later. And you can always contact us through our social media pages, as well as our website, www.patientsengage.com. So let's get started. We have a lot of ground to cover. Thank you, Dr. Priya and Dr. Deepak, for joining us today.
Thanks for the invitation. Yes.
Dr. Deepak, what is lung cancer? And, typically what stage do we see diagnosis happening?
So lung cancer is typically, it's a cancer which arises from the respiratory system like trachea, bronchus, or both lungs. So it's more commonly seen in males than females, and the median age is around 65 years. So most of the patients lie between 50 to 70 years. More commonly seen in males, and I think most of the patients do present with advanced stages like stage 3 or stage 4. Very few patients we see in early stages, and it's most common cause of cancer-related death also in both males and females.
Okay. And at what stage is it? You said it's late stages. Dr. Priya, what are the typical treatment options available for various stages of lung cancer?
So I think very important to understand the stage means extent of the disease. For any cancer, the important thing is all the treatment outcomes and the options are decided depending upon what extent of the disease patient has. Cancer has a problem, a big problem, and we all fear cancers because it can spread from one part to another part, isn't it? Like it can become stage 4, what we call. From lungs, it can travel to brain, to livers and lungs. So that is a stage 4 disease. So now the treatment will be depending upon what is the stage. So very early, that means teeny tiny lung nodules in form of cancers, they can be simply resected by surgery. So surgery is one of the curative treatment modalities in case of lung cancer. Okay, and that applies to many other cancers as well. Sometimes we see that the patient condition might not permit surgery. Okay, because lot of these patients are smokers, chronic smokers, so their underlying lungs are bad. They don't have ability to tolerate a surgery. So for these group of patients, we can actually burn the tumors, the lung cancer, by using radiation therapy. So you have surgery as a treatment option, you have a radiation therapy. So to put it simply, it's like laser gun to burn the tumors. Sometimes the tumors are big that you feel that surgery is not possible. Even there, we can burn them with radiation therapy. A lot of people know about surgery. Very few people have heard this term, radiation oncology. But yes, India is actually equipped with good radiation oncology expertise as well as machine. The other option is chemotherapy. Now people ask, what is chemotherapy? Why do we do it? Another problem with cancers is that it can go in the various parts of the body. Okay, and you have done surgery, you have removed the tumor, but because it has gone, the few of the cells have gone in the blood, it can come back. So we need to clean the blood also. Okay, so chemotherapy does that role. Okay, and yes, we have now newer treatment options such as targeted therapy and immunotherapy. Targeted therapy, as the name suggests, will hit a target. So we test the cancers for certain targets. And if we feel that yes, targeted therapy can add value to the quality of life, especially for the metastatic or the stage 4 cancer, they are very much part of the treatment. Immunotherapy is the latest arsenal in our armamentarium. There's actually an old concept which is now being used. Body's immunity not just fight infection, it fights cancers too. Okay, so a very specific kind of immunity is actually stimulated via immunotherapy to kill the cancers, and they have become very effective, especially for the stage 4 cancers. So these are the few treatment options that we have.
Right. Thank you. And you mentioned, and we'll come to, Dr. Priya mentioned these, when targeted therapy becomes effective, etc. So Dr. Deepak, can you explain the types of cancers, lung cancers, and, in what cases are these markers or whatever they are called? And, what are they called? What are patients? What should they be understanding?
Okay, so lung cancer is basically divided into two broad categories, non-small cell and small cell, depending upon the histopathological findings. And then this non-small cell is further divided into two different categories, squamous cells and non-squamous, like adenocarcinoma. So most of the adenocarcinomas are usually tested for genetic mutations, somatic mutations they have in their tumor, like driver mutation, which drives the cancer, which leads to development of cancer. And if we hit that driver mutation, then it means we have hit the engine of the process. So it will start killing these cells. So these driver mutations has to be tested on biopsy by various methods, laboratory methods which are available. And if there is some driver mutation we can detect, we can hit that driver mutation. There are now various drugs which are available for specific driver mutation, like for EGFR mutation, ALK mutation, KRAS mutation. So there is a list of mutations which are commonly seen in lung cancer. And there are few mutations we have active drugs also. And these drugs act specially on these patients which have these mutations. Otherwise, they don't work. So these drugs have changed the treatment landscape of lung cancer now. We are seeing longer survivals in excess of 2 to 3 years now with one modality only.
Right. Yeah. Thank you. So Dr. Priya, coming back, you talked of the various treatment options available. Can you broadly talk of the key side effects of each of those treatment options, and what are the options available to manage these? Like, people get very scared, right? And chemotherapy is like top of the list on people getting scared. So
yes, that's actually right. Most of people, they won't go ahead because there's so many people in the family and the friend circle telling, don't do chemo, it's a poison, don't do chemo. So yes, so I think the most important will be to discuss about the chemotherapy first. The problem with chemotherapy is that yes, sometimes there could be toxicities. In movies, we see hair loss. So yes, not all chemotherapies cause hair loss, but yes, hair loss could be one of the potential side effects. But yes, it's a reversible hair loss. Okay. Sometimes could be nausea, vomiting, change in mouth taste. Also, there could be fatigue. Diarrhea could be one of the side effects. Also, certain chemotherapies can cause tingling and numbness, what we medically called as some damage over the nerves, that we call as peripheral neuropathy. Fall in blood counts. So periodically, we might also give injections to stimulate or to maintain the blood counts. Now, important thing is, and it's because we are discussing the side effects, we have also now better supportive care so that the side effects have gone down drastically. At the time of administration of chemotherapy, patients will also be given certain kind of pre-medication. And also at the time of discharge, they'll be given gift list of medicines that they have to take to decrease the side effects. Also, there are certain other methods, like we were giving once in 3 weeks chemotherapies. Now there are other alternate schedule, like you can just split the doses, give it on a weekly basis, so that the side effects further decrease. So these are the usual side effects of chemotherapies and ways to manage them. Targeted therapy, which Dr. Deepak nicely explained. So, like they're very specific in their treatment, they are targeted therapies, but yes, they can still have certain side effects. There could be diarrhea, there could be rash over the face or any part of the body, and heightened photosensitivity. So these are the fewer side effects compared to chemotherapies. Immunotherapy again are considered safe, but immunotherapy again can sometimes overstimulate body's immunity, which can actually attack body's own cells, what we call as autoimmune manifestation. So, and that is highly variable, which part of the body they are going to attack. But sometimes they can attack your intestine or the gut, so there could be diarrhea. They can attack your joints, so there could be joint pain. But the percentage is usually mild. Sometimes they can affect your thyroid, so there could be like some kind of thyroid dysfunction. Surgery, we all understand, if you are, it's like cutting an organ, so there'll be blood loss. It will be done under anesthesia, so they'll evaluate for the anesthetic checkups. Other than blood loss, there could be pain, infection at the site of surgeries. So all those problems with the surgery. Radiation usually does not cause any major problem acutely, other than the redness, or the pain. But yes, there could be certain long-term side effects depending upon which part of the body is being exposed to the radiation. Right. But yes, these are the overall side effects. Yes.
Thank you, Dr. Priya, for explaining that so comprehensively. Dr. Deepak, are there any effects of the cancer or the treatment on fertility and sexual health as well?
If we are speaking about lung cancer only?
Lung cancer only, yeah.
All right. So usually lung cancer patients are diagnosed beyond age of 50 years. So infertility is not much an issue there because they are beyond the age of becoming a parent. And as far as sexual dysfunction is concerned, it is more commonly seen with those patients who have genital organ or bladder cancers or prostate cancer, because surgery, radiation, everything is focused on that part. But in lung cancer, if we speak about, yes, I think approximately as per the literature, 1/4 of the patients do have some sexual dysfunction, and it's most of the time because of either chemotherapy leading to some hormonal disturbances, ovarian dysfunction, or maybe because of anxiety or depression. So it may happen, and most of the time complaints are either erectile dysfunction, the lack of desire, or vaginal dryness. But actually, this is the Western data, and they also accept that most of the patients do not come back to their physicians for this counseling because they don't want to. And especially in Indian setup and our setup, it's very rare to find a patients who can discuss with you or report to you about these things.
Right. Dr. Priya, do you want to add anything from your perspective on this?
See that, ma'am, it's a very controversial topic in the sense that, yes, I agree completely. Nobody actually asked this question. Now, if you go to a Western country, the usual question in can we have intercourse during chemotherapy? In India, actually, nobody asks us that question. So, yeah, so that is the kind of discussion people are trying to avoid. So I'm glad that you are having this question. So during the chemotherapy, so we just want to add, during the chemotherapy, actually having intercourse is allowed, just not on the day of chemotherapy, most likely. But yes, like Dr. Deepak rightly pointed out, chemotherapy can actually cause fall in sperm count in males, and it can also impact the ovum production in the females. Not all chemotherapies, but yes, there are certain chemotherapies. But again, as rightly pointed out, because lung cancer is not the cancer which usually impacts young, so this problem does not happen. But yes, there are certain chemotherapy drugs which can decrease, which can have impact over the infertility. Now, fortunately, what has happened is, we have techniques of sperm preservation and oocyte preservation. So somebody who is young, who still wants to complete the family, these options are given. Like you have an IVF center, right? So where the sperm preservation facility is there. So those are being increasingly used now during as a part of the cancer therapy. We upfront counsel about these side effects and we give them these options. And yes, many of our patients are also taking up these options. Yes.
Right. Thank you. Yeah, and we know that patients don't know how to ask these questions.
Yes.
Sometimes they kind of will ask some counselor on the side, or there'll be
Yes.
oblique references to this. So we try and ask on behalf of patients and their families as well. What is the follow-up routine, Dr. Deepak, that you typically expect from patients over a long period of time? Because increasingly, cancer treatment is not an acute treatment, it's like chronic, right?
So it depends actually upon these stages. If it is early stage, then we do prescribe a CT scan for every 6 months or so for first 2 years, then annually CT scan. If it is little bit advanced stages, and then we reduce the frequency, we get it more frequently done, means every 3 months for first 2 years, and then every 6 months, and then annually. So in addition to these, we get routine tests done, and then because there may be some long-term side effects of treatment also, so we have to monitor the blood pressure, sugars, then heart function, because if someone has received radiation to that area, it may affect heart pumping function. So that heart function monitoring, then bone density monitoring, because osteoporosis may be a complication later on, and dental checkups routinely. So these are the common things which are advisable to do in follow-up scans and follow-up visits.
Right. Dr. Priya, one of the commonest questions that patients have is, nutrition, but I will add exercise as well to it. So if you can advise the role of nutrition and exercise during the treatment phase.
So fatigue is a very common problem during the treatment. Fatigue can happen because of the cancer itself, and it's also because of the treatment. Now, if you continue to maintain an active lifestyle, people think that if they are undergoing anti-cancer therapy, they should just come from hospital, they should go to the house and just lie down on the bed. That is not the right advice. They should remain physically active. If they can exercise, at least brisk walk, some amount of walk as per the stamina. Then keeping yourself physically active fights fatigue. It also decreases all other major side effects, and most importantly, it helps to maintain a positive mindset, isn't it?
Correct.
So physical active lifestyle and physical activity is very, very, very important. We don't advise patient to do a lot of bed rest. Okay, some kind of physical activity, they can do light jogging, they can do cycling, is yes, advisable. It's strongly recommended, I would say. Second, a role of nutrition. So then we hear a lot about what should you eat, about the prevention. There are a lot of thoughts going about the superfoods. If the patient has had cancer, then all those advice will still follow, isn't it? Because then now we are also trying to prevent recurrences. But at the same time, a word of wisdom: don't occupy yourself too much with the thought of what to eat, what not to eat, because we also want to give you a mental space to keep yourself away from the cancer, isn't it? So a well-balanced, nutritionally balanced, a diet which is rich in antioxidants, a diet which is rich in lot of raw fruits and vegetables. Okay, that kind of diet is something that is preferred and should be used by the healthy people as well as by the cancer survivors. There are a few kinds of food which we say that can cause cancers, like raw meat, processed meat, or the red meat. So that should be curtailed.
But you mentioned raw foods. Sorry.
No, you please carry on.
Yeah, raw fruits and vegetables.
Yeah, but raw foods and vegetables are not supposed to be had during chemo.
So see, ma'am, that was an older concept that even for blood cancer patients, we are just keeping that to maybe just blood cancer patients where they very intensely chemotherapy. And even now there, that this concept is debatable. People thought at one point of time that the raw fruits and vegetables will actually lead to infection. But now, at least for the solid tissue cancers and these kind of cancers and the treatment, the concept does not hold ground anymore.
Okay.
Importantly, that you are actually dividing yourself from a lot of nutrition and the other health benefits that you can get from these diet.
Correct.
So raw fruits and vegetables should very much be the part of your diet.
Okay, that's good. Yeah, thank you for clarifying that. Sorry, Dr. Deepak, you were saying.
No, I was just adding that healthy diet and healthy lifestyle is as important before diagnosis, during treatment, and after diagnosis also, because we want to reduce recurrence, we want to reduce symptoms of cancer, treatment side effects, and we want to improve the mental health and all this. So these things should go on throughout.
And people are just trying to ask all kinds of precautions. Can I meet somebody? They keep themselves isolated inside a house, thinking that they'll be predisposed to all kind of infection. Not all those precautions actually they hold ground. Okay.
Right.
So the best coping strategy is in fact to maintain your normal lifestyle.
Right. And on that, I think you talked of healthy lifestyle. Given that lung cancer still is largely driven by smoking, do most of your patients successfully stop smoking, or is that a challenge for them to stop smoking?
Patients who develop cancer almost never restart smoking. So like if you see the normal in normal population, there are high rates of relapses for smokers.
Right.
But once they develop cancer, almost I've seen very few patients to restart smoking now.
Right.
No, most of the patients do quit after diagnosis, but there are a few patients who continue to smoke after diagnosis also. So their family member keep asking that, ask him to stop. He's not listening to us. But most of the patients do stop.
See, one of the problem also with this is that a proper counseling regarding smoking cessation is also lacking. That should be a very much part. In many of the clinics now, in many of the lung cancer treatment, wherever it is going, it has now become part. But at many centers, it is lacking. We have to tell them proper advice, how to quit smoking. See, they have also a lot of guilt and shame. They are thinking all the time it's because I smoked that I had developed cancer, and I'm also causing a lot of problems to the family members. It sounds slightly different, but people who have a lot of guilt will actually restart smoking. So you have to attach them to a counselor who can help them in quitting smoking. There are medicines available also, not just patches, etc., but many other medicines also that will help. And yes, we have to take care of the mental counselor also to help in decide that how to deal with their mental these kinds of feeling of guilt and depression.
Right. Thank you. And talking of emotional and psychological needs, I mean, yes, it's for the guilt as well. But Dr. Deepak, are there other areas where you feel the need that you wish that you could refer patients to a counselor, etc.? And I know that we don't have too many counselors out there, but
actually, diagnosis of cancer itself is too much stressful for people. So they think their life is turned upside down. Why they go into depression? Actually, I've seen many patients, those who do not come out of their house even for treatment also after diagnosis. They say that they want to avoid things. They don't want to come to hospital. So we have a psychologist, means every hospital must be having one psychologist for such patients. And they need support for each and every step of their treatment, their follow-up also, because they have a lot of things going on in their mind about their finances, their jobs, their family, afterlife, what about after me? So these are the questions. Sometimes patient develop suicidal thoughts also. So they need continuous mentoring by some psychologists. They should always be supported by family members. They should live with family members, not alone actually. So they need some emotional and psychological support every time.
Right. Thank you.
Dr. Priya, anything from you?
No, sir. Actually, that's a very nice summary.
Yeah.
And importantly, we should also think about the, primary caregivers' mental state of mind. Many of the times they keep thinking that we are not doing enough. It's a very common discussion that what else. So it's very important that we counsel the patient and we should also arrange counseling sessions for the attendants also, the primary caregivers.
Yeah, thank you. I think that is very important, as you Dr. Priya and Dr. Deepak rightly said. One question that we've received is, when there are certain cancers which are kind of seen as more hereditary or, family propensity towards it, etc. So is lung cancer one of those? And, are there genetic testing, like you have, BRCA for breast cancer, which is available for family members? Dr. Deepak?
Okay, so lung cancer, as we all know, it's more driven by environmental factors like smoking, outdoor pollution, other radioactive substances. These are the main etiological factors. So genetics doesn't have much to play in hereditary causation of lung cancer, but those who have family history of cancer or those have family history of lung cancer in first generation, they do have higher chances of developing lung cancer, but its direct hereditary causation is not yet proved. We don't know whether it is because of hereditary or because of same environmental exposure. So more or less, till now, it is more likely because of environmental exposure rather than genetics.
Right. Thank you. And Dr. Priya, in terms of, we talked of kind of treatment side effects, but are there long-term effects that happen, over a period of time of, so it could be toxicities or it could be anything that people should monitor very carefully?
So yes, a very important question about the long-term toxicities. Now, 75% of the patients in India are actually present with stage 3 or stage 4 disease. We have fewer of the patients presenting with patients where we can actually cure them completely. So long-term toxicities, still the data is less in India, but yes, we have a lot of data from the Western population. So like if the patients are being given radiation to the lungs, especially for the left side tumor, we have heart, isn't it?
Correct.
So the heart can actually, some kind of chronic damage can happen to the heart, which can later on manifest as a cardiovascular disorder. So these patients can have earlier a cardiovascular disorder and some impact over the cardiac function. That is one of the problems seen. Now, fortunately, what is happening that we now have a better radiation machines. So the radiation side effects are lesser, but that it still continues to be one of the problems. The second problem with chemotherapy, like we were mentioning, we were discussing something about peripheral neuropathy. So chemotherapy sometimes can damage the nerves. So you will have tingling, you will have numbness, even the temperature sensation might be lost. Patients sometimes might have difficulty in opening and closing their buttons, clothes button, okay?
Right.
So, and in not all the cases, it will be, so it reverses, but not all the time it is fully reversible. So some kind of peripheral neuropathy can be present for a very long time. So these are the usual chronic side effects. And like if there's an impact over the fertility, so infertility is something that does not reverse. You just,
Right.
okay. So impact over the fertility could be a long-term side effects also. But yes, these are the predominant long-term side effects. Nothing major other than these. Yes.
Right. Thank you, Dr. Priya. Dr. Deepak, any final messages or words to our audience?
The best would be that most of the people do try to avoid the workup, biopsies, or treatment. So I would advise that still it's not beyond treatment. Cancer is still treatable. It's curable also in few patients. And even if it is not curable, we can provide you with a good quality of life and good quantitative life also. So don't avoid treatment, or please continue as advised. Always listen to your doctor, their advices, and don't think too much of yourself. You have queries, you can ask your doctor, but do continue as advised.
Right. Thank you. And Dr. Priya?
Ma'am, Dr. Deepak said the most of it. So what is important is develop a support group. There will be a lot of people who will give you all kinds of advices to do this, to do that, etc. It's very important that you identify a right kind of people in your home and develop a support group. It's very important that you get people who listen and not just give you advices. Also, a lot of people, they'll do just Googling. Again, it will take away that mental space that I want to give you to keep yourself away from your disease. Okay, so it's very important that you ask and search for the credible sources. You ask your doctors, they'll tell you what are the credible internet sources, because you get lot of, all kind of garbage, if I may use the word, on the internet. So just don't blindly Google. Ask your doctors to give you what are the credible online sources. We all want to know about the disease, and yes, researching is the right approach, but yes, find out what are the credible sources and go through them. That will be all.
Right. Thank you. Thank you, Dr. Priya and Dr. Deepak, for taking the time. And I think these are really important questions and messages that have been given. And I think we've covered a few very interesting topics in this, which, typically does not get talked about. So, and do remember that if you don't know what are the credible sources, do ask your doctor. And you can also ask us. We'll happy to point you towards credible sources. We are happy to point you to patients who are currently living with advanced lung cancer and are on treatment, etc. So those options are also available. Cancer is not something that you need to fear, and do go ahead with treatment options. And as Dr. Deepak also said, that if you need to do an additional test, it's not just a case of doctors prescribing a whole bunch of tests. Those tests help them decide treatment strategies. So I think it's important to understand that as well. And thank you once again to the audience for listening in, and to Dr. Deepak Gupta and Dr. Priya Tiwari for taking time on a Friday evening to talk about lung cancer. Thank you so much.